Hello, thanks for joining us again today. I'll give you firstly the usual run through of the daily statistics. I can report that the total number of positive cases that were reported yesterday was 203. This represents 4.4% of people newly tested and takes the total number of cases now to 23,776. Let me remind you again that these are positive cases reported yesterday because of the processing backlog we've been dealing with, which, as I said yesterday, is improving. More of these than normal may be from swabs taken over the past few days. However, as I've also said before, when we look at whether case numbers are rising or not, we look at results by the date the sample was taken, not just by the date it was reported. So the backlog doesn't in any way distort our trend analysis. The full regional breakdown will be published later as normal, but I can confirm now that 69 of the 203 cases are in Greater Glasgow and Clyde, 30 in Lothian and 29 in Lanarkshire. The remaining 75 are across the other 8 mainland health board areas. I can also confirm that 61 people are in hospital, which is an increase of 9 on yesterday. 5 people are in intensive care, that's the same as yesterday. And finally, I regret to say that in the past 24 hours, 1 additional death was registered of a patient who first tested positive over the previous 28 days. And that means the total number of deaths under this daily measurement is now 2,502. And of course, this is a reminder that we are again reporting deaths, albeit small numbers, on a regular basis again. That's an indication that in Scotland, as elsewhere, COVID is accelerating again, and I'll say more about that shortly. But I want, once again, obviously, to pass on my condolences to everybody who has lost a loved one to this illness, including, of course, those grieving as a result of the death that was registered yesterday. I'm joined today by our National Clinical Director, Jason Leitch. After my remarks, Jason will say a few words about the news this morning that an Edinburgh Rugby Academy player has tested positive for COVID. Before that, though, there are a few items I want to cover. Firstly, let me briefly highlight an announcement that was made by the Scottish Government last night. We have added 2 additional places to the list of those that are subject to quarantine restrictions, and those are Slovenia and Guadeloupe. That means that from tomorrow, people travelling to Scotland from these countries must self-isolate for 14 days upon their return or arrival in Scotland, and it is very important that people comply with that. By contrast, Singapore and Thailand were removed from the quarantine list, so anyone arriving from either of these countries from tomorrow no longer has to quarantine. But if you have arrived from Singapore or Thailand in the past few days, you do need to complete your 14 days of isolation. This is all, of course, a further reminder of how quickly levels of this virus in any country or area can change. So I will say again, please avoid non-essential overseas travel at the moment, if possible. Indeed, please think carefully about non-essential travel at home as well, and in particular avoid travelling to parts of the UK that are under tougher restrictions right now because levels of COVID are rising fastest. Now, the main thing I want to do today is just take a moment to take stock of where the country stands right now in the pandemic. We are seeing increasing numbers of places, both here in Scotland and across the rest of the UK, that are under local and regional restrictions. And of course, many of you will have woken up this morning to hear news of the potential for new national restrictions. The bottom line here is that this virus is on the rise again. Our case numbers are not yet rising as fast as they were back in March, but they are rising again, and they are rising quite rapidly. The percentage of tests coming back positive is also not anywhere near as high as it was back in March, but again, it is rising. And as I reported yesterday, the R number, we believe, is now above 1. Across the UK, this is particularly the case in England right now. Hospital admissions are rising. ICU admissions are rising too, and while this is particularly the case in England right now, this should sound a warning signal for us here in Scotland too. And while for the past few weeks people might have taken comfort from the low levels of older, more vulnerable people contracting the virus, I have to say to you that that picture is also beginning to change. Our most recent data shows that the percentage of cases in the older population is now beginning to rise as well. And looking more widely, we can observe that in broad terms, we might now be at an earlier stage on a similar path to that has been taken in recent weeks by France. About 4 weeks ago, France stood broadly where we do today, but now they have around 10,000 new cases per day, hundreds of people in ICU, and deaths in France are already rising now as well. So our task is to make sure, if we can, that we interrupt that and we don't end up where they are now. And what lies behind this is a simple reality. We are facing the risk again of exponential growth in COVID. And we all know from our experience earlier this year what that looks like and why it is so important to seek to avoid it. So I want to talk briefly about what we need to do. First and foremost, we need to act to interrupt that exponential growth. No one wants to see another full-scale lockdown. And above all, we want to keep schools and childcare open because we know how important that is to the education, but to the broader well-being of children and young people. So right now, and I mean right now, today, over the weekend and into next week, that means following all of the rules and advice currently in place. Work from home if you can, that remains our advice. As I said a moment ago, avoid if you can non-essential travel. Don't meet up with any more than 6 people from a maximum of 2 households, indoors and outdoors. If you live in Glasgow, as I do, or in East or West Dunbartonshire, Renfrewshire or East Renfrewshire, North or South Lanarkshire, don't visit other households at all at the moment unless you have to visit to care for or deliver shopping to a vulnerable person. The fact is, we know, and this is one of the things that we have learned about this virus, is that when it gets into a household, it is very likely to infect everyone in that household. So to be blunt, we must do everything we can to keep it out of our households. And when we do have to interact with others, the last piece of advice I want to remind you of right now is to remember to follow facts, all of the basic things that help us reduce the risks of transmitting the virus. So these are the current rules, and I'm asking everybody please to abide by them strictly and rigorously. But it may well be that if we are to interrupt and break this growth, we will have to do more over the next few weeks. And this weekend will be critical in the assessment of how best to do that. As widely reported, SAGE met yesterday. I have chaired a meeting of senior Scottish Government officials and advisors this morning to assess the current situation, and discussions across the 4 nations of the UK will, I hope, take place in the coming days. I've this morning asked the Prime Minister to convene a Cobra meeting over this weekend. So today I want to give the nation advance notice that the coming days are likely to see some hard but necessary decisions. If we want to avoid another full-scale lockdown, which all of us do, doing nothing almost certainly isn't an option. Now, I will, of course, as I have sought to do throughout this pandemic, keep you regularly and fully updated. But for now, over this weekend, please rigorously follow all of the current rules and all of the current advice. Now, there's another issue I want to update you on, and it's another area where some of us may be able to help in the fight against this virus, and it involves Scotland's involvement in the UK-wide COVID infection survey. This survey is designed to track the spread and the prevalence of the virus in the general population. It's conducted by the Office for National Statistics and the University of Oxford. And following a successful pilot in England, it has now been expanded to other parts of the UK. In Scotland, it will ultimately see up to 15,000 people being tested every fortnight. Households will be randomly selected for the survey, and over the coming period, these households will all be sent a letter inviting them to participate. Those letters will provide details on how to register. The first of them should be arriving today, and from Monday, survey teams will begin visiting households that agree to take part. Those who do take part will be asked to administer swabs to their throats and noses to test for the virus. People aged 12 years or older can take the swab themselves, but parents and carers should administer them for younger children. A subset of participants over the age of 16 will also be invited to provide blood samples to test whether they already have had COVID. Participants will be asked to take further tests every week for the first 5 weeks, then every month for up to a year. And members of the survey team will visit households to collect the tests. These results will help us to see how many people are infected with the virus at a given point of time, whether or not they have symptoms. And they will give us a sense of how many people are ever likely to have had the infection. And they should therefore provide us with really important new insights into the spread of COVID in Scotland. The survey will also provide additional data on the characteristics of those who are testing positive, and so it will help us to examine any difference in the impact of the virus on different groups in society. We expect to have the initial survey results for Scotland by November, but of course that is dependent, and this is why I'm raising it today, on people's willingness to sign up. So if you receive a letter and you are able to do so, I encourage you to take part in this survey. It is really important, and it will be a vital tool in our efforts to understand the virus and therefore equip ourselves better to know the things to do to keep it under control. Now, to close today, I want to really come back to my earlier point and just emphasise to you that we are right now at another really critical point. COVID-19 is on the rise, not just here in Scotland, it's on the rise in the UK and across Europe. Just yesterday, the World Health Organization warned that weekly cases across Europe have now topped 300,000. That's higher than it was in March when the virus first peaked. And as the WHO has said, that must serve as a wake-up call for all of us. The virus could get out of our grip again. That's the news that should be the wake-up call. The better news is that that hasn't happened yet. We do still have time to prevent it happening. And that is down to government to take a lead and be very clear and decisive in what we have to do. But it also ultimately comes down to all of us. So before I hand over to Jason, I just want to remind all of you watching and ask you to remind others of what we need you to do. If you live in Glasgow, East or West Dunbartonshire, Renfrewshire or East Renfrewshire, North or South Lanarkshire, please do not visit any other household anywhere in Scotland. In the rest of the country, don't meet with more than 6 people from a maximum of 2 households. Don't give the virus the opportunity to spread between households, because if it spreads between households, we know it quickly spreads within households. And download the Protect Scotland app if you haven't already done so. 1 million of us have done so already, and we know that will help make a difference. And finally, in everything we do, let's all follow facts. These are, as I keep saying, the 5 golden rules that help all of us minimise the risks of transmission. And those rules are, just to recap, face coverings in enclosed spaces, avoid crowded places, clean your hands, clean all hard surfaces that you're touching regularly, keep 2 metres away from people in other households, and self-isolate and book a test if you have symptoms. We are, as I said a moment ago, at a critical point right now. But as I said in one of these briefings a couple of days ago, nothing is inevitable. We all have power to try to stop this virus running out of control again. I know the responsibility that is on the shoulders of me and the government here to take the hard decisions that will determine whether we succeed or not. But as I have said so many times throughout, this is down to all of us. We are all in this together, and it is only by acting together that we can stop it running out of control and ultimately save lives. So my thanks again to everybody who I know is making all sorts of sacrifices to help us do that. Keep spreading the word to everybody you know. I'll hand over now to Jason before both of us then take questions as normal.
Thank you, First Minister. I can confirm that an Edinburgh Rugby academy player has tested positive for COVID. The young man in question is one of 4 academy players who attended a house party last Friday. In doing so, they breached the general restrictions on social gatherings and also the protocols that were agreed between Scottish Rugby and the Scottish Government. This is clearly unacceptable, and I'm personally disappointed that after all the hard work that's gone into the return of elite sport with the rugby authorities that this has happened. All 4 players are now self-isolating, and their contacts, including those at the gathering, are being traced. The health protection team in NHS Lothian has examined the implications for the rest of the Edinburgh squad, in particular the first team players who are due to play in France at the weekend. In doing so, they've examined training footage and GPS data and the safety measures that were in place. Based on that, they have advised that it is safe for the squad to travel to France and for the match to go ahead. This is a hugely disappointing incident for us and for rugby. Rugby, like other performance sports, has been given the go-ahead on the strict condition that clubs and players abide by the guidance that has been agreed. That's a message that we have re-emphasised very strongly to the relevant parties yesterday and today. I spoke yesterday and this morning to the leaders at Scottish Rugby, and they are taking this incident very seriously indeed. I've asked them to check and recheck their protocols and procedures and report back to me a week today. Incidents like this, and the ones we've seen previously involving other sports, underline a really key point which the First Minister covered in the round for the rest of the population a moment ago. Any time one of us fails to abide by the rules, we put others at risk, and we give the chance to spread and create consequences that are totally out with our control. Thank you.
Thanks, Jason. We'll move on now to questions, beginning with Ross Govins from STV.
Afternoon, First Minister. You seem to be saying this afternoon we've reached the tipping point in the transmission of cases where further restrictions will need to be imposed. But even with those restrictions, if the testing regime and the processing of those tests are still not adequate, aren't we just hitting pause for the problem and not actually tackling it?
What I'm saying right now about what may be necessary in terms of further restrictions is I would be saying, even if we didn't have these problems in the testing processing system. But as you've heard me say many times this week, I have been concerned and continue to be concerned if we are seeing those delays and bottlenecks in the system. It's an issue that the Scottish Government is engaging very closely with the UK Government on, and also taking steps ourselves to try to resolve where we are able to do that. The positive news is, and I said earlier in the week, I'm monitoring these figures on a very regular basis right now. And the good news is that we've seen an improvement in the last few days. We've seen the backlog that was a huge concern to me earlier this week reduce. But what we are now looking at and working to try as far as we can to ensure is that the turnaround times from now on don't start to slip again. So, this is not something that we will be taking our eye off the ball on any time soon, but there have been improvements that I think it is important to report. My advice to people on testing is, if you have symptoms, please go and get tested. And we know, and again, I'm not complacent about this, we're opening more testing centres all the time. A new one in Glasgow will open tomorrow. I spoke about that earlier in the week. But over the past while, we have not seen a difficulty, generally speaking. I'm not saying nobody has a difficulty getting a testing slot exactly when they want it, where they want it, but we've not had the problems that have been experienced elsewhere in the UK of people not being able to access tests. So if you have symptoms, go and get tested and self-isolate, because that remains one of the key ways we need to ensure that we break chains of transmission. And the sooner you get tested, and of course this is why we need the turnaround times for the results of the test to be quick, the sooner our contact tracers, who are doing a fantastic job right now, get to work making sure that all of your contacts are given the right advice. And of course, if you use the app, then anybody that you're coming into more random contact with and is also using the app also gets those notifications, which helps us spread that net much more widely. But we do continue to monitor the testing situation closely. I'll go next to Sam Coates from Sky.
First Minister, this morning Downing Street is raising the possibility of either a new partial or total lockdown, and there are also suggestions that we could see half-term extended to 2 weeks with kids kept at home for that period of time. How sensible and how close are those kinds of measures in Scotland? And are you prepared to commit for the whole of the United Kingdom to move as one on those sorts of plans? Or will you reserve the right for Scotland to do things differently, even if people can go across the border?
I don't know how much of my initial remarks you heard, Sam. I think I probably covered a lot of this, but I'll recap just in case you didn't manage to catch them. I think this weekend is a critical moment for us to take decisions about the additional steps we need to take to stem the increase in the virus. We look right now as if we are on a similar trajectory to France, maybe 4 weeks behind. But we shouldn't accept the inevitability of following that path. I think we need to consider what we need to do to to interrupt this and break it. So I do want to have Four Nations discussions around this. I've asked the Prime Minister to consider convening a Cobra over the weekend so that we can have those discussions. And we ideally will align as far as possible, but as I've said many times before, I ultimately, in Scotland, I'm responsible for these decisions. And while I want to try and align, because I think it makes sense in lots of ways, if there are things that I think, based on my data, my advice, that are essential in Scotland and other parts of the UK don't want to do them, which is their right, I am not going to hold back from doing what I think is necessary in Scotland. And I think people would find it odd if I gave any other answer to that. But I hope we'll have discussions over the weekend and we can try to come to a shared position of the steps that we think are necessary, with whatever variations we might all want to put into that. Aileen Clark from BBC.
First Minister, just on that then, I mean, you're clearly very keen that there's a Cobra meeting this weekend. There's lots of issues there to discuss. You talk about the warning signs that are clearly there and this being a critical time. So, I mean, would it be fair, to say to the public that they really should start to prepare themselves for more stringent lockdown restrictions coming in across Scotland? I mean, that seems to be the mood music with what's going on. And also, you spoke there about how in England the hospital admissions are going up, the ICU admissions are going up, clearly warning signs there. There must also be warning signs for you about how their test and protect system has come under the most immense amount of pressure at that stage. So, I mean, why is it that you seem to think that, we'll be okay? Have lessons been taken from what's gone wrong there?
I don't want to go over this. I know there are different people tuning into this from the media every day, but I've spent a lot of time this week trying to explain how the testing system works, the UK-wide network, what we can do, what we have to work with the UK government to do, the steps we're trying to take, the real focus and priority that I personally and the whole of the Scottish Government is giving to this, the improvements we're seeing, the concerns we still have, and the lessons we're trying to learn. So that will continue. The resilience and the robustness of the testing system, in order that then the protect part of test and protect can continue to work as well as it's been working, is crucial. So we'll continue to give that the utmost priority. In terms of, am I, effectively telling people to prepare, I used a phrase in my opening remarks, which said, I'm giving people advance notice that we are likely to see some very difficult but necessary decisions over the coming days. And, ultimately I'm responsible for the decisions the Scottish Government will take, and we will take those decisions on the basis of what we think is right for Scotland. Ideally, we'll be able to have a joined-up approach across the UK, but my responsibility is to take the decisions I think are right for Scotland. And let me be very clear. This is about trying to avoid another full lockdown. It is not a full lockdown I'm talking about right now. It's about how we take steps that might involve greater restrictions than those we're under right now, but will allow us to interrupt the increase in transmission and avoid going back into a March-type lockdown, and crucially, will allow us to keep our schools open. So that's the basis on which we're considering these issues right now, and the basis on which we'll take decisions over the next few days. Jason, do you want to say a bit more about the general picture just now and why acting quickly and early might help avoid greater restrictions in the longer term?
Yeah, so the WHO don't mention your continent lightly. So 2 weeks ago, the WHO said those in the Americas should pay attention because your numbers are accelerating. You should do things as countries. So yesterday, the WHO decided to mention Europe, and they said that we have reached 300,000 cases a week, and countries across Europe should start to pay real close attention to what they are doing. We looked just today at the European Centre for Disease Control, and every single graph of every country has a first wave and then flattening and then just outbreaks and numbers just beginning to rise. And we are not immune to that. Israel yesterday announced the first country in the world to announce a full second lockdown. And as the First Minister says, we have some early warning and we hope to avoid that. Just before I came down, I looked at each of the 4 UK countries, and all of us are struggling with large geographies showing increased numbers. So Bolton in England, Caerphilly in Wales, Greater Belfast in Northern Ireland, and you can see us in the west of Scotland trying to control those numbers. We're not immune to this virus, and we have to pay attention. The principal risk is household mixing, wherever that happens, whether that's in your home, in hospitality, in a place of worship, or wherever it happens to be. Household mixing is the principal risk we're trying to prevent here, and that will be the advice we give the First Minister over the weekend.
Which is tough, because this is about our interactions with the people we love most. But if we take early action, the hope is we can avoid more severe restrictions in the future. That's what it is about. It is partly about preventing something much tougher later down the line. Lewis Meeke from Bauer.
Thank you, First Minister. We've heard from soft play owners across the country this morning, and quite a few of them are saying that if they don't get to open again in October, or they don't have any additional financial support, that they might have to close, there might be job losses. So they're asking the Scottish Government today what can be offered in terms of possibly additional grants that some of the other industries in the phase 4 that have been delayed have also been offered.
Well, consider for any sector whether there's more we can do financially. Obviously, we are, and I think what the situation we're facing across the UK right now strengthens is the argument that the furlough job retention scheme really has to continue beyond October, which is a crucial lifeline for a lot of businesses that are still either not able to trade at all or are trading again but under continuing restrictions. So we will consider all of these things on an ongoing basis, as we always have done. Katrine Bussey from PA.
Good afternoon, First Minister. One of the things you said repeatedly at this briefing, I think, is that one of the measures the WHO uses for whether coronavirus is under control is the percentage of people testing positive, of this being at 5% or less. It seems to be we're getting perilously close to reaching that, and I wanted your thoughts on that. And also just with Professor Leitch saying there that household mixing is the problem at the moment. When you introduced the rule of 6 last week, you said you would seek advice on whether this would apply to children, if they would be only permitted to mix with one other household for children under 12. Do you have that advice yet? And given the situation, is it more likely that they'll have to abide by this rule and only mix with one other household?
I'll say a couple of words about both of those points, and then Jason might want to say more. I am hoping to see that advice on children later today and consider that over the weekend. I had hoped we might be able to confirm the position today, but it's going to take a couple of days longer. I'm not going to preempt that because I've not had the chance to read the advice yet. But, clearly everything I have said today should tell people we are in a very, very critical stage of this. And I just want to say that, not particularly related to this issue, but more generally, that we have to be very mindful of introducing more opportunities for household-to-household transmission at a time when we know we are probably going to have to try to do the opposite of that and actually restrict those opportunities. But I would hope on Monday to be able to give a view on that based on the advice that, as I say, I hope to see later today. On the 5%, you're right, I have said this many times. I think it's important to say, like all of these things, we want, like the R number, we want to keep it below 1. It's above 1 just now. We want to keep positivity rate below 5%. It's not when you get over these numbers a switch flicks and everything changes. You want to keep these things as low as possible. But on the figures I've been reporting this week, and you've got to be careful with day-to-day figures. So we look at these kind of things on a 7-day average. But clearly positivity percentage is rising, 4.4 today. So over the last 7 days, I suspect when we look at that average, it will be somewhere between 3 and 4%. I'd rather it was back down where it was a few weeks ago, which is closer to 1. Back in March, it was 20%. Yeah, although back then we had a much narrower testing approach, so that will have influenced that as well. But this all brings me back to my central point. We've a decision to make right now. We know if we do nothing right now, we're probably going to see exponential growth again. And we can look at France and predict where that might take us. So this is a moment where we have to decide, are we going to act to interrupt that and make sure that that is not inevitable? And these are the decisions that we will be considering very carefully over the course of the weekend.
So if we had a dashboard of COVID, you would have the R number, you'd have positivity rate, you'd have prevalence per 100,000, and you'd probably have multiple other data points. So if you had an R number of 0.6, a positivity rate of 0.8, and a prevalence of 4 per 100,000, everything would be green. The advice to the First Minister would be that COVID is presently under control within the country. Just now, we have a positivity rate of 4.4, probably just below 4 over the whole week. We have a prevalence rate approaching, if not slightly over 20, and we have an R number over 1. I think that's amber, at least amber. And that's why you're hearing us use the tone and the language we're using. It's not red, but we don't want it to get to red.
Thank you. Conor Matchett from the Scotsman.
Thank you, First Minister. You mentioned earlier about the possibilities of, or the fact that testing is showing that the virus is entering elderly communities again. Yesterday, we reported on a care home in Edinburgh that was linked to 13 COVID deaths back in April, rated as unsatisfactory for infection control. What's your reaction to that? How confident are you that care homes that struggled with the virus in the early stages are ready to face it again? And if I may, we also saw that Edinburgh University is threatening to suspend and exclude students who break the rule of 6. Wondering what your thoughts on that and whether or not you endorse that move.
I'll hand over to Jason in a minute on care homes. My apologies, Conor, I've not seen the report you refer to, although obviously I look at care inspectorate reports and other information on care homes very regularly. And we're not complacent in any way, shape or form about care homes generally or any particular care home. But we have learned a lot of lessons over the last 6 months. The oversight and governance around care homes, particularly relating to COVID and infection control, is very different now. We have, governance that's led by directors of public health in each health board area. Obviously, we've got a different testing regime in care homes, and there is a process underway right now before we head into winter of looking afresh at the guidance and considering any changes that need to be made there. So this is something that is very, very high up our list of priorities and the whole range of things that we need to take account of. On the Edinburgh University, I think universities are rightly taking the risks of transmission amongst their student populations very seriously. And I think students have to be very clear about the do's and don'ts, not because we're trying to blame young people or curtail anybody's social life. Many moons ago now, but a former university student, I know how important everything that goes around university life is, so it gives nobody any pleasure to be trying to restrict people. I've got a nephew who just started at Edinburgh University at the weekend, so I know how difficult this is. But universities have to be very clear with students, and students themselves have to be clear about the risks and how to minimise those risks. I think all universities would say there's a balance to be struck between being very clear that there could be consequences if students, flagrantly breach the rules, versus wanting students to come forward if they do have symptoms and do have concerns. But overall, and this is a comment that applies to university disciplinary procedures, but also to enforcement more generally, this is a moment to remind ourselves that we all have to do the right thing here for the good of the country as a whole and for the good of each other. Not a single one of us wants to be living under these restrictions, and none of us want our young people to be living under these restrictions, but it's necessary just now to keep this virus under control, and everything we do as individuals potentially affects our own well-being, but it affects the well-being of those around us as well. And I know, young people don't want to be putting themselves or others at risk. So let's all just take this as a moment to remind ourselves of that sense of solidarity that I think we all felt very strongly back in March, April, and actually has served as well. This is a moment to pull together again and do the difficult things for the right reasons, which is, of course, keeping the virus under control. Jason?
I think both of the areas you ask about, care homes and universities, are special and have guidance of their own to try and keep them safe, just like all the other sectors in the country. We have learned a great deal in the last 5 or 6 months, and care homes have learned along with us around PPE, around testing, around the regime of infection and prevention control, around the governance that the First Minister mentioned from health boards. So I'm as confident as I can be that we're in a good place, but this virus doesn't need much encouragement. It can get into places even when they feel very, very secure. That's a real balance, because I'm very conscious of my inbox being filled with people who are really missing visiting and seeing their elderly friends and relatives, and I am too. So we need to try and do that as safely as we can, while also protecting that group within our society who are living in their homes inside those care homes. Universities as well, we spent a lot of time with them, but you can see at the Napier University story just in the last few days how easily and quickly the virus can spread from household to household, whether that's a student residence or your own home. It's the same message. And it's hard to tell freshers and people who have just come back to university after a long break to obey those guidelines, and I get how difficult that is, but you have to. And that's why we're seeing numbers begin to rise, and we'll see it move into elderly and vulnerable people in the next few weeks if we don't stem that just now.
Matt McLaughlin from The Times.
Hello, First Minister. Douglas Ross today has launched his education plan, and his big idea is to have a national tutoring service, lots of publicly funded tutors to help children who have fallen behind during the coronavirus. Is this an idea that the Scottish Government would support and pay for?
I've not seen the detail of what he's called for. Happy to look at it. I'm happy to take ideas from wherever they come. Of course, we have already made funding available to increase the numbers of teachers and support staff in schools. And that is partly about recognising the increased workload that COVID brings, but also that there is a real need to help young people catch up their education. So there is action already underway on that front, but of course we'll consider any further suggestions that people make. Simon Johnson from The Telegraph.
Good afternoon, First Minister. Obviously, until now, in recent weeks, we've seen very localised lockdowns with specific measures targeted at the specific reasons for those outbreaks. I was just looking for clarity that, again, we're now you're considering national measures again. And you used the word interrupt in your opening remarks, and I just wondered, how long of sort of interruption would we require to get the virus under control again? And lastly, you'll have seen the restrictions announced for the northeast of England yesterday. You said in your opening remarks, people from Scotland should avoid travel to those areas. Would you also discourage people from Northumberland travelling to Scotland this weekend?
Yeah, look, again, this is purely public health. I long for the day that we all just see whoever we want to see and travel where we want to again. And you know, that includes travel from Scotland to England and vice versa. None of us want to be in this position, but I think all of us right now should just be very cautious about non-essential travel. So yes, I think if you're in Scotland, you shouldn't travel to areas in the north of England that are under restrictions, not least because you're not helping those areas by going there, and people in those areas, I think there may be some travel restrictions associated with some of these English lockdowns just now, but you shouldn't come to other parts of the UK. Similarly, in Scotland, if you don't live in, Glasgow, for example, right now, which is under greater restrictions, if you don't have to go to Glasgow, then don't go. And people in Glasgow, likewise, if you don't have to visit other parts of the country, don't do that. This is all really, really tough stuff, but it just comes down to, if we all restrict as far as is possible for us to do our interactions and our travel to other areas, then we squeeze this virus, we push it into retreat as opposed to allow it to spread. We should all think right now, wherever we go, we could be taking it with us, or we could get it there and bring it back. So if we just restrict all of that, however difficult it is, we minimise that. On the first part of your question, I wish I could answer these questions definitively, like how long. These will be things we are considering carefully over the next few days. So what I'm talking about just now, yes, we have parts of the country under more severe restrictions just now than other parts of the country. That remains a possibility if we've got particular outbreaks in particular areas, but we're starting to see In Scotland, and probably this is more the case across England just now, but we've seen this across other parts of Europe, that what has been for the last few weeks a problem of localised outbreaks is becoming a bit more widely spread in the community. I mean, again, today, and this, I don't think it's been the case every day in the last week or so, but most days we've got cases in every health board, mainland health board area in Scotland. I think yesterday we had a case in the Western Isles as well. So it's a bit more spread out, and that means we have to consider now whether some national restrictions, we have national restrictions in place already. The 6-2 rule is a national restriction. Do we need to have more national restrictions? And these are the decisions that we will be pondering and trying to come to conclusions on over the next few days. And we don't want anything like that to be in place longer than it has to be. But we know also from bitter experience in the last few months, this virus has a life cycle that is not in days, it's in weeks. So the incubation period of up to 14 days, the time it can then take for people who are going to become ill. So it can take a period of weeks to know whether something you start doing today has an effect. And these are all things that we have to have in mind when we're coming to these conclusions.
If I take you back to the early days of the route map, we stood here and we talked about the first outbreak we had. Seems like a long time ago now in Dumfries and Galloway with Gretna and Annan, and we made national choices about closing down small pieces of geography and stopping people travelling. That is still going on, but it is being done by local health protection teams. The next layer up is Lanarkshire and Glasgow. That doesn't feel very local. That's 1.5 million people being restricted. That feels regional, semi-national. So it's not a big jump from there to think if we've had to do that for 1.5 million people and numbers are rising in other places, we may have to think about those national restrictions. And that's how it should work. Local protection teams are still dealing with outbreaks the size of that Dumfries and Galloway one. They're dealing with them all over the country now. We don't hear from them because they're so much more common. Now that we're beginning to see it everywhere, the fires are beginning to light. We've got to think about regional restrictions, which is what we've done in Glasgow and Lanarkshire. And that takes us into the territory where some of the advice will have to be about national restriction.
Tom Martin from the Daily Express.
Hi, good afternoon. Thank you, First Minister. Could I just pick up on, obviously we're now almost 3 weeks into, some of the local restrictions that came into place in the west of Scotland, but again, we're seeing big numbers. Is what's in place not working? Why haven't we really started to see that slow down after a couple of weeks, now almost 3 weeks?
I think, I know you've had colleagues on the call for the last couple of days, Tom. I can't remember if you were here, but we spoke a bit about this earlier in the week. So I can't remember now if it was Monday or Tuesday. The days are all running into one. But we extended the restrictions for Glasgow, the Renfrewshires, East and West Dunbartonshire for an additional week. The North and South Lanarkshire, which came into place last Friday, will be formally reviewed today, but I would expect them to be continued as well. So put Lanarkshire aside because they've been in place for a shorter period. The other areas, as you rightly say, has been sort of 3 weeks now. We do think they're having an effect. This is what we spoke about earlier in the week. We think there is in the data an indication, not that cases there have started to decline yet, but that what we always look for is the first positive sign that the rate of increase is slower than it would have been without the restrictions being in place. So we've blunted the increase. So that's not enough, obviously, if cases are still rising, but it is an early indication that there has been an effect of those restrictions. Clearly, we want to do more than blunt an increase, so we have to consider they might be having some effect, but are they enough to have as much of an effect as we want? So that will be part of the consideration for the whole country as to whether we just need to do more to actually push this increase into reverse as opposed to just slow it down, which I think we can start to think we've been doing in the west of Scotland. Yeah, okay. Michael Blackley from the Daily Mail.
Thank you. Good afternoon. It sounds like what you've been describing today is effectively what's being termed as the circuit breaker lockdown restrictions. Should people be preparing for those to potentially come into force as early as next week? And also, given that the your warning seems to be that people need to follow the rules this weekend. I mean, can they still visit one other family member, for example? Can they still stick to that rule and still do that, or should they really just be trying to cut themselves off and stay at home this weekend?
So I'll try to take your questions in order so that I don't confuse myself, let alone anybody else. But whether you call it a circuit breaker or a fire break or whatever, that is the kind of thing that I think we're all thinking about just now. How do we act quickly, early, decisively to stop a deteriorating situation getting worse and instead really push it back onto the right track again? Now, I think those decisions have to be taken in fairly short order. That's why the Scottish Government, and I can only speak for my own government, over the weekend into the early part of next week, we will be considering what that might look like and what steps we think it is necessary to take at this stage. And as I said earlier on, we'll also be seeking to have some Four Nations discussions to see whether, given that we might all be at slightly different phases, but we're all facing broadly the same challenge, whether and to what extent we can align some of that. So that's the first part of your question. Second part of your question, look, the rules are as the rules are right now. And if we change the rules, I'll stand here and set out what we're changing them to. So unless you live in these 7 local authority areas, Glasgow, East and West Dunbartonshire, Renfrewshire, East Renfrewshire, North and South Lanarkshire, where you should not be meeting with other indoors with other households. In other parts of the country, yes, the rule is you can meet with up to 6 people from a maximum of 2 households. So that is permissible within the rules. If you don't have to do that, if over this weekend you're kind of in two minds about whether to go and meet another household or not, then maybe don't do it, because you'd be sort of reducing any risk there. But it is within the rules to do that at the moment. And if that changes, I will set that out. But at the moment, I think all of us should just be thinking about, is this journey really necessary? Is this social gathering really necessary? Because everyone that isn't necessary, that doesn't go ahead, we've taken away one opportunity for the virus to spread. And all of that adds up. Every single little thing we all do as individuals to try to reduce the risk of spread all adds up to a bigger opportunity to stop the virus spreading. Do you want to add anything?
I was just going to repeat the risk thing again. I get probably the question I get asked most is, why am I allowed to do this and not this? And that's all about the addition of risk. So if we said all bets are off, we're back to normal, the virus would rise exponentially and people would die, for sure. So therefore, underneath that, you've got to make judgments about risk. So if you cannot mix households, that is less risk, no question. But we've also got societal harms because people need care, people are fed up, people need to see their families. We've got economic harms, so people want their businesses and their economy open. So in that balance is somewhere with essential versus non-essential. That's an ill-defined word, but you should think carefully before you mix a household. It's as simple as that.
Christine Lavelle from The Sun.
Thank you, First Minister. It was just on testing capacity. You'd previously announced plans to increase Scotland's daily testing capacity to 65,000. By what date are you aiming to do this? And is there a target to go any higher? And is there any risk of this being hampered by the recent problems in the UK system?
It's all part and parcel of the UK system. I know this is really complicated, so I keep sort of trying to explain it also. Our capacity, we have NHS capacity that is Scotland only, and then we have a Scotland share of the UK-wide capacity. So we are trying to increase that capacity overall, and it's also really important that the two strands of capacity can interact and work in concert. The target we set remains. I would like us to go further than that, but we're focused right now first and foremost on trying to resolve some of the issues that we've experienced over the last period, and that means working closely with the UK government as we do that. But we all want to take capacity for testing beyond where it is now, beyond the targets that we had set before. But I don't want to stand here and just reel off numbers beyond that target when we know we have to work through some particular challenges that we're facing right now. Andrew Learmonth from The National.
Thank you, First Minister. Mark Drakeford at his coronavirus briefing has just criticised Boris Johnson for an unacceptable lack of COVID discussion between the four nations. He says there's a vacancy at the heart of the UK with little discussion and a lack of information being shared. He said he's only had one brief conversation with the Prime Minister since May. Can I ask if you share those concerns, how the communication is between you and Downing Street, and when the last time you spoke to Boris Johnson was?
I can't remember the last time I spoke to Boris Johnson directly, which maybe tells its own story. Look, so Mark Drakeford is not saying anything that is not correct. Most of the Four Nations discussions recently have been with Michael Gove, which are, I'm not criticising that they are helpful. I think they could do with being in a more regular rhythm and sometimes being a bit more meaningful in terms of us actually discussing what we're going to do as opposed to hearing what the UK government is going to do. But I'm focused now on trying to suggest a way forward. I think it would be very helpful to have a PM-led Four Nations Cobra type discussion over this weekend, because this might sound like quite a dramatic thing to say given what we've all been through in the past 6 months. But right now we're probably the moment we're in right now is probably the most critical point of decision since the one we faced in late March. And that's why I think that discussion at that level with that urgency is really appropriate this weekend. And I know the First Minister of Wales shares that view, so hopefully we'll see those discussions happen in that form. Helen McArdle from the Herald is the last question today.
Afternoon, First Minister. I just wanted to ask about some of the hospital admissions data. I was looking at Public Health Scotland data, the latest publication this week, and it seems that up to August the 5th, people under 45 made up about 9% of hospital admissions for COVID. But in the most recent month, from August 5th to September 9, under 45s were 21% of admissions. So I just wondered, is that of concern? And also in light of the update you gave today on the hospital patients going up to 61, are you able to give any indication of what the sort of age mix is of patients currently in hospital?
I'll hand over to Jason in a second. I don't have the Public Health Scotland report in front of me, but obviously I'm familiar with it, but so I'll not try and quote the statistics out of it. I can't give the age breakdown or any other breakdown of the 61 today. Public Health Scotland will do their analysis of that in the normal way. What I would remind people of is that, if I'm announcing either for hospital admissions or, what I'm announcing in these daily briefings are the number of people in hospital. So on any daily basis, that will be a net figure which will include people admitted and people discharged. Public Health Scotland on a weekly basis publish the number of people who have been admitted, and those are the figures I think you're quoting from. The one thing I would say, and I don't want to overstate this, but it's something we were discussing earlier today, and I think I'll maybe let Jason say more about it, but I think it is a reflection perhaps of some of the data elsewhere in the UK as well, that we are seeing a rise in hospital admissions. We're not yet seeing that in Scotland to the same extent as in England, but I would expect that is just a matter of time if we don't interrupt things. But there is also a sign that it's not just older people that are being admitted to hospital. There is a sign that some in the younger age group are also amongst hospital admissions, which is a reminder that while younger people are less likely to get ill, they can get ill. So in every aspect of our data right now, there are warning signs flashing, and that has to prompt us to take action, which is why I've been giving the messages that I've been giving today. But I'll hand over to Jason, who can probably say just a little bit more about the hospital admissions and the demographics of all of that.
I'm not sure there's too much more. Helen, your data, I'm not sure exactly what your date ranges are, but that would fit with the pattern of disease we're seeing across the UK and across Europe, that when this virus was at its previous peak, it was all ages, particularly the vulnerable, and therefore the group who were under 45 was proportionately smaller. That makes sense. They're not immune. I have a good pal in his early 40s, been sick for 3.5 months from this disease. I have another good pal who's the longest intensive care admission in Scotland, who's 50. The last little proportionate bit, the 7th of September bit you quote, 21% under 45 makes perfect sense to me, because that's the group who are getting the infection in the last few weeks. That, unfortunately, will not change. That will not stay in that group, because we know that it moves in incubation chunks of 2 weeks at a time into other populations, unless you do something. And the only two things you can do are test and protect and human behaviour. So those two weapons are the only things that will stop that proportion going down and older people becoming the higher proportion, and they are more at risk if they end up in hospital. But let's be very clear, it feels so harsh. People in their 20s have died of this disease globally. It's not that you're immune because you're young. You are much more at risk if you're old, much more, but you're not immune if you're young.
Thanks, Jason. That concludes the questions. Thanks to Jason, and thanks to Rachel for the BSL interpretation today. Thanks to all the journalists. I want to just round off, I suppose, by trying to take a broad sweep of the past 6 months. And while I think we are in a really concerning situation right now, we should not, absolutely not, think of the sacrifice of the last 6 months as being for nothing, because nothing could be further from the truth. You know, back in March, we faced out of control, exponential growth of this virus. We acted, country went into lockdown, every single one of us made horrible sacrifices, separation from our loved ones, our lives turned on their heads. And the effect of that was to, slowly to start with, but surely and then much more quickly, we drove this virus down. And in the course of all that, countless lives were saved because of that. So we got the virus to a really low level. That's why over the summer we kept saying, take a cautious route out of lockdown to drive it as low as possible. It was really important that we did that. But we also have known that when we come out of lockdown and as we go into winter and those two things happen coincidentally, then the risks of transmission rise again. Now, the advantages we've got now versus March are that we drove it to a low level over the summer, so we're starting from a lower base, and we've got test and protect, which is a key and vital tool. And notwithstanding the challenges you've heard me speak about this week in the testing turnaround, that system is working well and is really important. So these two advantages now are the product of all the sacrifice and all the work we did. But the virus is rising again, globally, across Europe, the UK, and here in Scotland. So we can't do nothing. We've got to add something else into that mix. But because of these advantages, hopefully what we have to do will be less than the full lockdown that we had to do in March. But we have to do, we think, a bit more than we're doing now just to stop and stem the transmission. And if we act early and act decisively, then we can have a bigger impact and avoid that prospect of a fuller lockdown later on, and hopefully, as we do so, keep our children in education, which for me, and I'm sure for so many across the country, is the prize that we keep focusing on. So that's why we are where we are, and it's why we are having to consider and make these potentially difficult decisions. There'll be lots of consideration and discussion over this weekend. I will, of course, keep you updated. I'll be back here on Monday to give you a sense of where we are and whether and to what extent we've reached decisions. But in the meantime, we all know what we've got to do as individuals to help, even before we take any further decisions, to try to keep this under control. So let me end by reminding you and asking you of the things that we need you to do, and we need you to persuade other people to do over this weekend and into next week. So firstly, if you are in these affected areas of the west of Scotland, just to recap, that is Glasgow City, East and West Dunbartonshire, Renfrewshire, East Renfrewshire, North and South Lanarkshire. Do not visit other people's houses. Don't have people outside your own household in your home, and don't you go and visit anybody else, even if they live in other parts of Scotland. I'll use, again, my own example. I live in Glasgow. I can't have people in my house, but I can't go and visit my parents who live in Ayrshire, which is not an affected area. In other parts of the country, 6 people from a maximum of 2 households. That's what we are saying the rule is right now. But as Jason said earlier on, if you don't have to go and meet another household at all, then don't do it, because you're reducing the risk of transmitting the virus. Secondly, download Protect Scotland, because that helps make sure that if you do get the virus or you come into contact with somebody who has it, you can be notified and you can act through isolation to reduce the risk of passing it on. And thirdly and lastly, if those essential interactions that we still all have to have sometime, when you're having those, make sure you're following all of the basic advice to try to reduce the risk of passing or receiving the virus from somebody else. So that comes back to facts. Face coverings, remember to wear your face covering in any enclosed space. Avoid crowded places, whether they're indoor crowded places or outdoor crowded places. Clean your hands, take hand sanitizer out with you, clean your hands when you go in the house after being out. Clean hard surfaces that you're touching, because we know the virus stays on hard surfaces. Keep 2 metres distance from people in other households where you are interacting. And lastly, self-isolate yourself and book a test if you have these symptoms of a new cough, a fever, or a loss of or change in your sense of taste or smell. It's all tough stuff, but it is all fundamentally basic stuff. And if we all do it, we all collectively help keep this virus from running out of control again. And that's where I'll end, because, I remember vividly back in March when we started imposing these restrictions, I had no idea of how the public, you, were going to respond to this. And I remember being overwhelmed by the sense of solidarity that was so obvious across the country. We all knew that we had to act in these ways to protect each other. And we knew we had to do it to stop people dying. And that remains true. We are in this together. Our experiences are all different, and I don't want to underplay this, but we are all in this together, and we will only get through it and save lives if we act together. So let's find that spirit of solidarity again, and we will get through this. A week ago today, Nicola Steedman, the Deputy Chief Medical Officer, stood here where Jason is now and said something that I think we should always remind ourselves of. This won't last forever. It will end. And we should keep that in mind, but we need to do the right things now to make sure that we get through it with the minimum number of people losing their lives and becoming ill as we possibly can. So thank you for joining us today. Please spread those messages as far and wide as you can. I'll be back here on Monday. If there are any developments over the weekend, obviously we'll keep you posted, but in the meantime, have as good a weekend as you can. Please stick to all the rules, and I'll see you on Monday.